I want you to assume that during the course of performing the permanent catheter replacement on August the 12th of 2011, that Dr. Corso used first a J-wire with this catheter, which I've marked as Defendant's Exhibit number 14. Are you familiar with this type of catheter?
Yes.
What is this kind of catheter?
It's a KMP catheter. It's sort of a workhorse type catheter that we use.
Would it be consistent with the standard of care for Dr. Corso in using Defendant's Exhibit number 12? Is this a J-wire?
Yes.
Okay. To use the J-wire and this catheter to get access into the anatomy of the superior vena cava, inferior vena cava, right atrium in order to do the permanent catheter?
That's the way it's done, yes.
All right. And that's all within the standard of care?
Yes.
Okay. So what's the advantage of using these two things first before going to a stiffer wire in a surgery like Miss Bailey's?
Well, the advantage of the...
Here, I'll let you...
Okay.
You want
So-
to use those steel shirts and I'll hold this.
So you always have to have wire access because the wire is really the rail over which the catheter and any catheter will go. So that's kind of your rail. So once you've got that rail in place, because of this tortuous and scarred anatomy that I talked about, so let's say that your catheter's here and it goes up here and there's scar tissue and it's angulated here, so there's an extensive angulation. The softer Medcomp type catheter is not going to track over a wire that is relatively floppy and not stiff. So what you can do is once you have the catheter in position over this wire, and this catheter will follow that wire. It's a small catheter. It looks like a 5-French, which is a very small diameter catheter. Then you can put that catheter over the wire, and what I can demonstrate for you what we do when that is. Sorry. We put glasses. So the catheter, the wire is in the catheter, and we've got the catheter now in position where we like it. Can you hold that right there?
Yeah.
So now what we can do is then take this wire out, and now we can put in a stiffer wire. And the importance of the stiff wire...
Before we get to that, Dr. Dobler, Dr. Corso has testified that he would have this catheter down in this position down here in the inferior vena cava. Would that be an appropriate place to have this catheter before inserting the stiff wire?
Yes, I think it would be appropriate to have it in the inferior vena cava. You could have it in the superior vena cava depending on the anatomy, but certainly in either the superior or inferior vena cava would be appropriate.
Okay. And then the testimony in this case, Dr. Dobler, has been that the next step, once this catheter was in place and that wire was removed, is that Dr. Corso inserted the stiff Lunderquist wire. And was that an appropriate wire to use for Ms. Bailey's surgery?
I think it was, again, based on the left-sided approach with the tortuous anatomy and the scarring that most certainly had to be there because of the multiple catheters she previously had. So if you don't use the stiff Lunderquist type wire, what will happen is your dialysis permanent catheter will kink or it won't go or it won't follow, and so you'll end up not being able to perform dialysis. So that's the reason that we, in a case like this, we will always tend to move to a stiffer wire.
So I'm going to jump ahead. The Lunderquist wire was placed by Dr. Corso. This catheter was removed. And then once the Lunderquist wire, the stiff wire, was in place, by the way, does it have a floppy end to it?
Right. Although the Lunderquist wire is an incredibly stiff wire, it's not stiff at the end, it's very floppy. The last 4 centimeters of the Lunderquist wire are kind of very floppy type end. Do you have one?
Yeah. This is Defendant's Exhibit number 13. Is that a Lunderquist wire?
Yes, it is. So you can see that this is very stiff, but this is not at all. This is very floppy here. So, you can, push that against your skin and it won't hurt anything. If you take the other end of this, it's like a coat hanger, really. It's that stiff in terms of, its stiffness. But the key about this particular wire is that because of that stiffness, you're able to then track something as large and not real floppy and malleable over this wire to position it in place in the great vessels so that you can perform dialysis.
So reasonable doctors doing this procedure, would they want to use a stiff wire in a patient like Ms. Daly to get this in the right location? Or would they want to use a really flexible wire?
I think that actually it's safer in a case like this to use the stiffer wire than the more flexible wire, because what can happen if you have a real flexible wire in is that the wire will not stay where it's supposed to be, and the catheter itself can then perforate these very thin-walled veins. I've seen that actually happen before by not using the stiffer wire in a case like this. It wasn't my case, but one of my colleagues had that happen. And sort of the aftermath of it was, we always talk about what happened, what could we do differently to make this safer, and his comment was he should have used a stiffer wire.
So